friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. And also you can visit the playlist. In the playlist I have provided all the topics in a very systematic order. So it is quite easy for the study. Anyway, thank you very much. So in the last class we are discussing about Ayurveda treatment of spastic cerebral palsy. Today we will continue the same. In the last class we have discussed about Sodhana. Especially in the Swedana, we have seen different types of Swedana procedures. What are the different options we will have that can be practiced? Now, today we will see the Shirodhara. Now, Shirodhara is one more important method in case of cerebral palsy. Now, Shirodhara, Shirobasti, actually talking, it is practically very difficult to perform in case of cerebral palsy. One is the postural problem in cerebral palsy and also irritation of cerebral palsy patient, spasticity, postural problems, and lack of cooperation. So these are some of the issues related to performance of Shirodhara or Shirobasti in children, especially children with the cerebral palsy. So instead of going for this classical Shirodhara or Shirobasti, if it is possible we can perform it. Otherwise it is better to go for Shiro Lepa or Shiro Talam or Shiro Pichu or Shiro Tarpana or Tailapatachil or Shiro Abhyanga as a substitute for Shirodhara. Okay, so usually this can be even performed in the home also. In the hospital setup you can educate the parents how to do it, then they can perform it in the home also on the daily basis. So practically Shirodhara is quite difficult, as I told, to conduct the cerebral palsy due to lack of cooperation and also due to the postural problems. So Shirodhara can be practiced as a substitute for it by different methods like Shirolepa, etc. Now how Shirodhara actually works? Now Shirodhara actually works by modulating the brain function. Now this is important. Now this is the one which actually changes the brain neuronal environment. Okay, just like major drugs. So Shirodhara also helps to modulate the brain actioning. It helps in altering the concentration of the neurotransmitters. Many studies have been also done on this. Okay, neurotransmitters of the brain. Especially it increases stability. We know that during Shirodhara what actually happens is patients sometimes go into sleep also. Now if you practically talking, sleep is actually sleep, digestion and excretion functions. So all these functions are basically cholinergic functions, not adrenergic functions, cholinergic. That means your parasympathetic nerve system take care of all these things. Sympathetic nerve system takes care of the emergency and other things. Parasympathetic nerve system is responsible for sleep. Parasympathetic nerve system is responsible for the digestion, secretion of so many enzymes, hormones, glandular secretions, etc. and then also excretion. So here basically if the patient is getting sleep after doing Shirodhara means, so basically it is stimulating the parasympathetic nerve system. Parasympathetic nerve system is the one system which keeps the person cool and calm. Okay, so there is cool and calm means the control, stability will be there. Okay, so in other words to say, I can say this decreases the excitability of the neurons. It is increasing the parasympathetic function and therefore it is decreasing the excitability of the neurons, which is actually required for us in case of spastic cerebral palsy, because the neurons are overexcited here. Excited neurotransmitters are more excited, therefore persistent function is there leading to spasticity. So that is required. So that is done by Shirodhara. The drugs which are used for the Shirolepa, most preferable is Jyotishmati Taila, Bala Taila, Tunga Drumadi Taila can be also practiced, of course. Himasagar Taila can be also practiced to some extent. Jyotishmati Taila is for the patients a little bit costlier sometime. When you go for Shirodhara or Shiro Taila and all, so a lot of oil is also required. Anyway, some other options are Lepa of the Amalaki with the Panchagandha Churna and Balamula Churna is also practiced, and Vacha Churna is also practiced. Lepa prepared by different major drugs can be also done. Even it can be mixed with the Kshirabala Taila also, and it can be applied. Another is Shiro Pattabandhana with the Kalka of the drugs can be also done. Just like in the limbs we are going for Pattabandhana, we can also go for Pattabandhana in the Shiro area also. So drugs which are usually those which increase the neurotransmitter, especially cholinergic, parasympathetic. Okay. So cholinergic is related to the rest, digestion, metabolism, and elimination. Here it gives a rest. In that means it decreases the excitability of the neurons. So now in the next class we will discuss about the role of Basti. Basti is considered as the best treatment for the children, and even for the cerebral palsy also Basti is considered as the best treatment. So that we will discuss in the next class. Till then, goodbye. Thank you very much.